finally, I just want to say something about ADHD, because often students that are very intelligent stumble into a program either having had the diagnosis, and then because they exit young people's services, it's assumed that they don't need treatment anymore, and they get lost in the shuffle. And in fact, they can come unstuck very quickly unless they get back on their medication. But the other interesting thing about the condition, which incidentally is primarily distractibility, inattentiveness, impulsivity, it's a sort of triad of difficulties. 3 to 5% of the population. The American classification system is saying we now have up to age 11 to recognize it. It used to be said you had to diagnose it by age 7. And in fact, a lot of the intelligent kids sneak through the school system without being pegged because they're more the daydreaming, inattentive kids. But because they're so intelligent, they still do their schoolwork. And this is why some of these people can be undiagnosed even into student life. But then the complexity of the lecture system, the complexity of the tasks, it starts to unravel because you're not as spoon-fed for the first time in your life. And I have met many students who have gone through the school system and don't have anything in their school report suggesting this is what the issue is. But then because of this multitasking, team-building nature of university life, it becomes apparent this is the diagnosis, and if it gets recognized, if it gets treated, it'll keep them in their course. So it's a very worthwhile thing to pick up, and I love treating it because you can sort of almost see the results in terms of charting the person's enjoyment through academia and the reduction in their, the improvement in their scores with whatever exams they're doing, whatever course assignments they're doing. And the other thing is, in this age of possible Scottish nationalism, ADHD, would you believe, is actually a Scottish diagnosis. The first physician to fully describe it was a fellow called Alexander Crichton in the late 1700s, who wrote the first mental health textbook in the English language. And he was so eloquent with this disorder that he said that individuals with this have what we call the fidgets, which so eloquently describes the way some people jump around in the chair, can't sit still, and can't focus on anything. Actually, the Crichton Hospital in Dumfries is named after this fellow, but he was physician to one of the czars of Russia for a number of decades as a result of the success he had with this book. You know, here we have this diagnosis being described eloquently in the late 1700s, and we're still debating in medicine now whether it's a true diagnosis or not. Now, needless to say, I'm on the side that it very much is. And you know, it's highly genetic. It often runs in families. There's a lot of good evidence that it's not just people having poor concentration on a bad day. But the difficulty is a lot of the symptoms are on a trajectory. You know, you and I can have days when we're scatterbrained and daydreaming and impulsive. But it's just that when you look at the whole picture, there's something much more than that goes on with the student with ADHD. But if I had to pinpoint a single label in mental health which gets such easy, you know, sort of misrecognition and doesn't get treated, it would probably be that one. I mean, most of these other major mental disorders stick out like a sore thumb. You know, if somebody's psychotic, they're not going to go very long before people pick that up. But this is much more common. So I think that's basically where I'm coming from with it, and I'm very much open to questions, dialogue, criticisms.